Hi and welcome back to the channel. Today I'm bringing you a very interesting case of an athlete with shoulder problem. As you probably know, the shoulder is a very complicated joint that is prone to a lot of problems. This is because it's at the root of every movement in our arm, but also because the joint itself has so many different kinds of movements that it makes it very prone to injury. In this case, I'm treating a 32-year-old male athlete. He trains Judo and competes in Judo, and he has a history of shoulder problems on his left shoulder. And the problem started many years ago because in training he dislocated his shoulder multiple times. And as you probably know, when this happens, that you dislocate your shoulder, every time the shoulder pops out of the socket, everything that's around the joint, holding the joint in place, all the tissue around the shoulder, be it the muscles, the tendons, the fascial tissue around the shoulder, begins getting looser and looser. So every time the shoulder pops off, it's easier for it to pop off again and again and again. And it got to the point where he was having multiple dislocations a year. He could just pop it back into place, and sometimes he would even keep on training without seeking any kind of medical help. When he came to see me the first time, he was having a lot of problems with the shoulder because it had popped off 2 or 3 times in a row, and he was having a lot of pain. I told him the pain was easy to fix, but maybe we could help in recovering a little bit of the problem of the loose tissue around the shoulder, allowing it to pop off. If you'd like to learn more about the techniques that I talk about in my videos, check out the courses I have available. I have courses in Portuguese and in English, so check them out in the links below. In these courses I teach the balance method to treat pain. This is a technique where you get instant relief in most pain cases. So if you want to learn about it, check them out. This is a surgical case. There's unfortunately no way around it, but as he is still competing at a high level, he doesn't want to stop for the surgery. So he decided that we would try and help with acupuncture for him to compete as long as possible. And then when he was done with competition, when he reached all the titles that he wants to, he would retire from competition and then do the surgery. And what do we need to focus here in order to help in a situation like this? Because we know we can't heal the full joint. It's not possible to completely recover the original tension of the tissue around the shoulder joint. It will always be easier for it to pop off than a healthy shoulder. That's why it's a surgical case. But what I wanted to focus on was first giving the muscle back its elasticity and tension, strengthening the tendons, and mainly working on the fascial tissue, because as you know, the fascia is a tissue that connects everything. It's in between the muscle layers, it's between muscle and tendon, it's between muscle and bone. And this is very important to hold everything together and also keep the shoulder together, but allow him to have full range of motion so he can keep training and keep forcing it. And I decided to work on 2 approaches at the same time. First, acupuncture, and then what is, in my opinion, the most important approach, which is Moxibustion. And I used Master Tung acupuncture plus 2 Moxibustion techniques to help this patient. First, let's look at the points that I chose. The first point, and if you follow this channel, you probably know what the point is going to be, is Sanjian, or the 3 shoulders. As you can see here, this is a set of 3 points located very close to the thumb, and it has the Sanjian of the kidney and the lungs. This, in my opinion, is one of the strongest points for shoulder pain. I always use the 3 needles, regardless of if it's sensitive or not, and I always use it on the same side as the pain. So I use these 3 points on the left side, which was the side of his injured shoulder. So I used these points to treat the inflammation and the pain that he was feeling in the shoulder, and to keep the shoulder as healthy as possible in order to be able to do the rest of the work and for the shoulder to get stronger. The other point is also a classical Master Tung point for shoulder pain, and it is Shen Guan, or 7718. This point has the Shenjing of the 6th Fu, but is very well known for 2 things. One, it's very well known for helping to treat the kidney, particularly the yin of the kidney. It's one of the most advised points to treat the kidney within Master Tung's acupuncture. In fact, there's a famous letter from Dr. Yuan Guoben to Dr. Xuanmin Wang, which are 2 very famous Master Tung students. And he says that when he wants to treat the kidney, Shen Guan is one of the main points that he uses. So this is a very good point to treat the kidney. The other thing this point is known to do is to treat the shoulder. So I used it on the opposite side, so on the right leg, to treat the left shoulder. This point is particularly interesting for this situation for a few reasons. First, of course, it's known to treat the shoulder. But in this case, we know that we have a physical injury to the shoulder. The bone comes out of its socket. So when we have an injury of the actual joint, we have an injury of the yin, treating the kidney is always a good option. So a point that strengthens the kidney is a very good choice for a case like this. But we even have another layer that will help us. This point, as you can see in the image, is located over the spleen channel. This point is very close to spleen 9. Well, in this case, we have a problem of holding, right? As I've said, the shoulder is not able to hold itself in place, and it pops off of the joint. And if we're treating the spleen, we're helping the body to hold, and we're treating also the muscles. So this is a perfect point for this situation. And these were the only 2 points that I used, and then I used Moxa on the patient. As I said, I combined 2 techniques of Moxa. The first thing that I did was okyu, direct Moxa, or grain of rice Moxa. You might know it by different names. As you can see here in the video, the first thing that I'm going to do is locate points where I feel tension in the muscle. Preferably not only points of tension, but points that are also sensitive for the patient. It's almost like looking for acupoints. And I will locate points around the shoulder joint and mark them here. Then I'm adding Shionko cream. This is a Japanese cream that is used in combination with Moxa. And I will use grain of rice or direct Moxa. As you can see here, I'm doing small grains and I'm going almost complete burn. I'm burning 90 to 95% of the cone because I want a very strong effect on the points. So I'm letting the cone burn to around 90 to 95%, and then as I put it out, you see I don't pinch it, I actually hit it, and this gives even a stronger heat sensation. The patient feels almost like he's going to be burned. I didn't want to burn the skin, but I wanted to get as close to burning the skin as possible. Because in this case, I'm treating pain and inflammation, but I also want to increase blood circulation to the area, because for the muscles to get their tension back, for the tendons to get their tension back, we need blood flow in the zone, so I wanted a very strong stimulation. As for the second technique that I used was the Ontake. I already talked about the Ontake here on the channel. As you can see, this is a bamboo tube, it's completely hollow, and inside we place green Moxa, like the same Moxa that goes inside of the Moxa cigars. And you press it, and then you can use the Ontake to massage the area. This technique is very good to improve circulation, but it's also amazing to treat the fascia. And this is my main goal in this treatment, is to recover the fascia, because it will be very important for the shoulder to maintain its integrity. And here you can see several massaging techniques that I use with Ontake. This is not a full video on Ontake, but if you want a full video just describing different techniques and how to apply it, just let me know in the comments and I'll do a video for you. And this was the treatment for this patient. This is the second time we're doing this treatment. The first time was almost 1 year ago. Back then we did 3 sessions like this until he felt that the shoulder was without any symptom, and he felt that the shoulder was strong when he trained, either when he was in the gym lifting weights or when he was actually training judo. After this, the patient was able to train and compete for almost a year without any issue with his shoulder. And now he came again because during the last week the shoulder almost popped off once. He began having some symptoms and then it actually popped off at a second time in training, and now he was in a lot of pain. So he came back for us to do the same treatment. This was the first treatment and he left without any pain in the shoulder and feeling that his mobility was getting back. I'm aiming at doing again 3-4 sessions until he feels the shoulder is strong again, and probably will be able to hold off for a few more months so he can keep training and competing. In a situation like this, I always advise the athletes to come for regular visits, like once a month or something like that. I hope with this video you understood first the importance of combining techniques. And here I'm using Master Tung acupuncture with Moxibustion, which is, in my opinion, an amazing combination. Even though Master Tung was famous for not using Moxibustion in most of his treatments, but for us common mortals, I think we need to use every help we can. So learn different techniques and learn how to combine them. And the second thing is for you to see the importance that acupuncture can have in maintaining long time and chronic injuries. In a case like this, we have an athlete, very active, an athlete of a very violent sport, particularly violent for the joints, and he's been able to keep training without the surgery that might end his competing days with the help of acupuncture. You're an acupuncturist, learn advanced techniques, learn advanced Moxa, learn Master Tung acupuncture, learn balanced method acupuncture so you can give this help to your patients. And if you're an athlete and you're still not using acupuncture, I advise you to really look into it. We can help on athletic performance, we can help recovering faster from injuries, we can help with anxiety, so we can help almost in any aspect of an athlete's career. So if you're serious about your athletic career, you really should be looking into going to a good acupuncturist. Thank you so much for watching. If you like this video, don't forget to like and subscribe to the channel and share this video with anyone that might benefit from it, and I'll see you in the next one.